Well, for the past few weeks, we've been talking about measles cases popping up here in the inland Northwest, with 3 confirmed in North Idaho and 1 presumed in Spokane County as well. Joining me now is Mark Springer from the Spokane Regional Health District. Good morning, Mark. Thanks so much for being here. Mark, we wanted to bring you in because you cover, you kind of track and you also cover investigations with diseases. Can you tell us more about the situation and the status on where we stand with these measles cases? Because it seems like it's in the news right now, but just how serious is it right now?
You know, it's significant for us because, you know, with the cases that we've seen in Idaho, those cases didn't have any travel outside of the state. So what we're thinking and what the data suggests is that, you know, that there's some transmission that's occurring that we're just not aware of. And so that always worries us that there could be cases that haven't been identified and transmission that's ongoing.
So on that note, though, do you think that there's more cases that just have not been reported yet?
I think that's not unreasonable to think about. And when we look at the cases in Idaho, there's usually a 21-day incubation period after someone's exposed to that, where they can start to develop symptoms. And so we're still within that time period, and we should still be alert for additional measles, you know, with our healthcare facilities, our healthcare providers, and with the general public.
And you also, in terms of tracking cases of measles, you had mentioned that you track through wastewater. Is that primarily the way that the Regional Health District can track some of these cases?
Well, that's one way that we can get a signal that's not dependent on people coming to a healthcare provider. So it can sometimes give us an early indication. Idaho does track that with their wastewater testing. Washington does not. And that system did give us some indication that measles was happening in Idaho before those 2 individuals tested positive. So it did give us a warning signal.
You know, right now we are heading back into school. A lot of people kind of going back into, you know, environments where there's lots of people and germs and all those things. Can you talk about prevention? What are things that families and parents can do right now in terms of measles prevention?
I think there's probably 2 main things. I mean, the first piece on prevention is really to kind of verify or know your status in terms of protection. A lot of times we assume that if people have gotten immunizations in the past that they're protected against MMR or measles with their MMR, and what we want to make sure with parents is to verify that, because if they can verify that, the vaccine is very good, they're going to be protected if there's an exposure. If they can't verify that, then they can get you know, a booster shot, or they can get a test to see if they're immune. And we want to get those things done before, you know, there's an exposure. You know, we want to identify that early. And then, you know, after the fact, if people have symptoms that they're concerned about, we want people to reach out to their healthcare provider. But it's really important that they contact their healthcare provider if they're concerned about measles by phone, so that they're not going into a clinic setting without putting in precautions to make sure other people in the waiting room, in the hospital, aren't going to get exposed.
All right. Well, Mark, thanks so much for joining us this morning.
Thank you.
Much more information on the Spokane Regional Health District's website for more resources. We'll be back in just 2 minutes.